For many people in the rural communities of 4 Nigerian states, it is now easier to know their HIV status and to receive care close to them. Treatment, care, support. Mariam knows this. Mariam Yusuf is one of the over 10,000 persons for whom life has become a lot more meaningful since 2013 because of the differentiated care provided in her community. Mariam Yusuf is married a second time, and they have a happy family. Her first husband died of AIDS, but she survived and is thriving through the US government-sponsored intervention that provided treatment, care, and support, such that helped her find love again and live a normal life. The next half an hour is a story of hope for persons living with HIV. It is not the everyday conventional story. It is a story of hope, smiles, a story of people who have found renewed strength to pursue purpose, a story of communities that believe in life without stigma. It is a colorful story of healthcare facility facelift, modern equipment installation, buildings renovated, and independent electric power generation, provision of routine training, and mentorship sessions on the ages of thought-through, homegrown, and workable approaches of intervention that has yielded favorable results in the face of anticipated failure, skilled and motivated health manpower. Saminaka is a town in Lere local government area of Kaduna State, Nigeria. It is located on the way to Jos from Kaduna, the capital of Kaduna State. Saminaka is where Mariam now resides with her family. Aisha is Mariam's daughter, and she loves her parents.
My name is Aisha Omar. I'm very happy for having good parents. My parents are living happy with us.
My name is Mariam Yusuf. I'm HIV positive. I have HIV positive from my late husband. I have the HIV positive, and my late husband have hide the HIV to me, and it's not disclosed himself to us until he get sick. So I'm back by me. So my CD4 count is high. What we are down. Now one program can convivial noverapine. Lamovidin, Zidovidin, noverapine. Ni one for me nibana. That ni viral load me wa load.
Whenever someone is diagnosed with HIV, he needs to start on treatment. Treatment that we usually start is called the first-line antiretroviral medications or regimen. The first line are usually more effective, they have less side effects, and they're even cheaper to procure at individual or national level. We prepare clients who start antiretroviral medication on first line to be maintained on first line. This can only be achieved if they are regularly adherent to their medications. If these medications fail, we have to move someone to second line.
But in that viral load me is 380. You know, me do. You know, me do. Me sunkún nínú clinic. Me sunkún me I say me niku. I think I'm worried. Doctor is expecting to me say.
Most of our patients are able to achieve viral load suppression by 6 months. And at 6 months, those who are not suppressed are subsequently evaluated for intensive adherence counseling, and those who are judged to have failed virologically or immunologically are switched to second-line therapy.
Láti ìgbà tí mo ti ń lo mẹ́là kò sí nǹkan kan tí ń ṣe mí mọ́, mo gbádùn, mo sì ń enjoy ní rẹ̀. Gbogbo nǹkan tó bá ṣẹlẹ̀ tí ara mi ò bá yá bá wọ́n máa ń mú wa gidi níbi ibẹ̀ ni wọ́n yẹn fi wá ṣeré.
Mariam Yusuf is one of the beneficiaries of the Supporting Universal, Comprehensive and Sustainable HIV/AIDS Services in Nigeria Success Project. It is a United States government-funded intervention implemented by the Friends for Global Health Initiative in Nigeria, FGHIN. Implementation of the Success Project began in July 2013. Friends for Global Health Initiatives is currently working in 4 states, which are Kaduna, Kano, Kogi, and Gombe states. In this state, FGHIN has selected health facilities that we are supporting to provide care and treatment for people living with HIV/AIDS.
I mean facilities that provide HIV treatment. They provide drugs and they do all the laboratory tests, and they also provide care, to these patients and their families. We have placed people on treatment. Currently, we have people that FGHIN is providing care and treatment for. In terms of, apart from this, we also do other services. I mentioned care and support, such as TB screening. All of the patients that come to our facilities also have the opportunity to be screened for TB, because TB and HIV also have a relationship. We also provide OVC services, and although this is largely managed by our funders, who were provided with care, which included education, health care.
The overall goal of the Success Project set out to develop and sustain local capacity for public and private healthcare delivery facilities and community-based organizations, CBOs, to provide and expand community and facility-based HIV and AIDS prevention, care, and support and treatment services in Nigeria. The goal fits into the United Nations Program on HIV and AIDS, UNAIDS target 90-90-90. In the communities where the Success Project was implemented. In the last 4 years, the Success Project has brought the communities closer to this ideal. In 2001, the federal government of Nigeria, through the Federal Ministry of Health, had commenced a program of universal accessibility of antiretroviral drugs.
I can remember over 25 or so years ago, as a senior consultant clinician in a teaching hospital in Nigeria, where our hospitals were basically taken over by dying people, predominantly people living with HIV. And what were we doing then? What we're basically doing was just offering them hope of a better tomorrow. And they were dying by the numbers, they were dying by the thousands. And then HIV was basically a death sentence.
The challenges I faced then was, were not being able to share it with anybody, and then going to the hospital and I still can't access medication because they were expensive. Drugs were very expensive, and then for you to get the drugs, even with your money, you have to wait for someone to die. You have to wait for someone to die before your name can be included on the list.
Now, across the journey, it's like we've seen the transformation that has happened from initially what, with the initiation of democracy in Nigeria with the government of President Obasanjo, I was privileged to be one of those that was included in the first government of Nigeria initiative to directly combat HIV services locally. And that was the first time that the democratic government of President Obasanjo, as a local initiative, decided to put about 10,000 to move up to 100,000 patients on antiretroviral drugs.
The Success Project supported the Federal Ministry of Health of Nigeria in the implementation of HIV-related services in Kaduna, Kano, Kogi, and Gombe states. The services include adult and pediatric HIV care and treatment, prevention of mother-to-child transmission.
4 major elements of the WHO and United Nations, which is number 1, for every woman that is of the age of reproductive age, for us to prevent getting infected with HIV for those of them that are negative. For those who are positive, is for us to ensure that they only get pregnant when they want to get pregnant by offering them family planning. And for those who are positive and who are pregnant, what do? We intervene by providing them with medications, antiretroviral drugs, to prevent them from transmitting that infection into their unborn baby or into the to the child that they give birth to. And also we give those children that they deliver to, we give them antiretroviral therapy to serve as a prophylaxis to prevent them from acquiring those infections from their mother. And we go ahead to also test them, several kind of tests, including PCR tests, to confirm after they are born, maybe they are infected or they are not infected, and we follow them up to for 18 months.
So far we have 8,000 of orphans and vulnerable children in our program. We have transited some of them to the government of Nigeria. We have also graduated some of them to the community. You know, what services we offer them educational support, health care, psychosocial support, nutrition, you know, shelter in very, very, you know, extreme cases. And then also we graduate them, you know, to the community and to Ministry of Women Affairs.
Testing and counseling, TB, HIV, orphans and vulnerable children, strengthening of laboratory infrastructure, and improvement of strategic information services in Kaduna, Kano, Kogi, and Gombe states.
The Strategic Information Unit of FGHIN was able to come up with electronic medical record system that is built on DHIS2 platform. The EMRS is built with validation rules that simplify data quality checks. The EMRS is web-based and is hosted on the cloud so that facilities and service providers can access the EMRS anytime on the web.
These are the ways life began to change for Miriam, and the man who would later become her husband got another chance at living through access to these interventions. Availability of antiretroviral drugs for persons living with HIV infection has been a major challenge in Nigeria. When awareness of the disease got very high, and there was an increase in voluntary counseling and testing.
General Hospital of Eko, of Enigbala, what fẹ́ is that
health facilities and health workers got overwhelmed. Across the country, 25 centers were selected to start providing triple combination of ART. Patients like Abidemi were experiencing frustration. Managers of the HIV and AIDS program started considering other ways of decongesting the health facility. They trained ad hoc staff to take on tasks such as packaging medications, collection of samples, and provision of support. In most of the communities where FGHIN worked, an innovative solution has been introduced. Motorcycles were commissioned and deployed because of the ease of maneuvering them. The I-DOT pharmacy system was also deployed to facilitate efficient and automated dispensing of drugs for trained bike riders to take the drugs to the comprehensive sites where clients can have access to them, and in some cases, to deliver drugs to clients who have difficulty making it to the care facilities. But in all the locales and institutions where the Success Project worked, the organization, collaborating with CBOs, local influencers, and gatekeepers, have a careful mix of institution strengthening, capacity building, service provision, and prevention.
The FGHI program, since when they came here, my people, they embarked in coming receiving the drugs. The program they came for on Tuesdays and Thursdays every week. They came here to collect the drugs, and many people have becoming cured. And we thank God, a lot of them, they know the impact now, that it is been reducing drastically now in the community.
Primarily, stigma, which was a major problem associated with HIV and AIDS, was tackled. A carefully structured support group system inspires confidence in members to discuss and get answers to critical topics about sex, stigma, nutrition, livelihood options, and others.
We have gotten support from Friends for Global Health Initiative Nigeria in terms of equipments. We have lab trainings, pharmacy training with the introduction of IDAT dispensing database at many intervals in monitoring and evaluation unit. And then we have trainings on the adherence counseling, even participate in the Niger Call activities, which Al-Nuri Special Hospital was one of the participatory hospital, and among the other health institute.
I will say that it has positively impacted on everyone, not only the patients that have HIV. And this is because they have a system that makes it possible for their activities to be part of the hospital activities. They are not seen as alien to a beautician hospital. They are part and parcel of a beautician hospital because of their integration system that allows the institution to gradually take over whatever they are doing. That is to say, we have good participation. We are almost, I would say, in charge of whatever is happening there because the management is fully aware, fully involved, and we work together. It's like it's a department under a beautician hospital.
Oh, now it's wonderful. The drugs are free. We get the drugs free. In fact, the whole treatment is free. Getting tested is free. When I tested, you pay for it. I paid for it. And then now it's free. Getting the drugs too is free.
One of the key achievements of the Success Project is the introduction of the gender dimensions to HIV care and support. This progressive step was taken in the rather conservative city of Kano, where Al-Nuri Specialist Hospital introduced discussions with community members on gender-based violence and reproductive health rights.
Gender-based violence can occur in form of rape, which is very common. You find many young teenagers some even under the age of 10 are being raped. And we do provide counseling and medications to prevent HIV infection among those who are affected with gender-based violence.
To abinda nake so a yi a ci gaba da aiki, ina ainihin roƙonsu kar magani ya yanke, don shi ne babban maganin kenan. Magani ya yanke to abubuwa za su koma ba. Saboda haka ina roƙo in ma akwai abin da za a yi ƙoƙari gwamnatin tarayya ta sa hannu wa sauran ƙungiyoyin nan a ƙarfafa musu so that a samu dai magani dai kare yanke.
Gratitude fills the air, though uncertainty still lingers in their thoughts.
Well, from here, if you look at it, it's like over the last 4-5 years, with the contribution that we've had, particularly from the United States government through the Presidential Initiative funding, that's PEPFAR, we have moved beyond even our expectations in terms of trying to achieve control of HIV as a public health menace in Nigeria. Are we there yet? We're not there yet, but we're indeed hopeful that if we continue along this path, particularly using local partners in terms of real retained sustainability, then this shall be that true thing that has shown the fact that this can work not only for HIV, indeed for most, if not all, public health issues in Nigeria.
Esther Ishaya, guardian of Mary, speaks about baby Mary, who is a carrier, and the fact that she needs care and more attention to develop in her life as her parents lost their lives to HIV.
To, sunana Esther Ishaya, shekara na kuma 30. Wannan yariya sunanta Mary, babanta kuma sunan shi Bitrus. Dalilin ɗaukar wannan yariya iyayen sun samu kansu a cikin wannan shuta. To kuma Allah ya sa Allah ya kiraye su.
It's the great philosopher Confucius who said, "Do not worry about holding high position. Worry about playing your proper role." The Success Project has contributed beyond measure within the limits of resources available to the FGHIN, but there is more to do. But Marcus Aurelius's words comfort you. Never let the future disturb you. He advises, you will meet it if you have to, with the same weapons of reason, which today arm you against the present.